Let's be honest, no one wakes up at 70 or 80 thinking, I can't wait to spend the morning coughing and clearing my throat. Yet day after day, many older adults find themselves stuck in that exact routine. The truth is, it's not simply dryness, old age, or plain bad luck. In most cases, there are very real, often preventable reasons behind it. The encouraging news? Once you understand what's driving the problem, there are simple, natural steps that can make life more comfortable. By the end, you'll know 6 practical things you can try tonight. No costly treatments, no confusing medical language. But first, we need to clear up one common belief that leaves too many people suffering longer than they should. When just aging isn't the answer. For many older adults, the explanation they've been handed is simple. Excess mucus is just part of getting older. It's talked about like graying hair or stiff joints, something you're meant to accept without complaint. That assumption leads to resignation. Days begin with a clogged throat, a chest that feels heavy with phlegm, and a morning ritual of coughing and throat clearing. Too often, the discomfort is dismissed with a shrug and the thought, that's just how it is after 60. But here's the problem with that mindset. When mucus is brushed aside as unavoidable, people miss the real reasons behind it, and also the chance for relief. The risk of writing it off as inevitable is clear. Once someone believes the issue can't be changed, they stop asking the questions that matter. They may never notice how hydration levels, medications, or room conditions are at play. And they miss that mucus isn't just a nuisance, but sometimes the body's way of signaling irritation or imbalance. Health reviews in 2025 show that in most seniors, the explanation isn't aging alone. It's usually tied to preventable or treatable factors like environmental triggers, acid reflux, medication side effects, or dehydration. If these are overlooked, the cycle continues without resolution. Surveys and clinical reviews show many older adults assume mucus is just part of aging, which means treatable causes often go uninvestigated. This tendency fuels unnecessary suffering. Millions live with year-round congestion that could often be improved by changes as simple as better hydration or adjusting nighttime habits. To put the health stakes in perspective, CDC data also show that adults over 65 account for most severe outcomes from seasonal respiratory infections. While mucus doesn't always indicate illness, persistent symptoms in later life deserve attention instead of dismissal. One story captures how powerful even a small shift can be. In his late 70s, a man spent years living with constant throat clearing that worsened in the winter and never fully disappeared in summer. He never raised the issue with his doctor and joked that it was just part of growing old. Then his daughter brought home a small digital humidity monitor. It revealed his indoor air dropped to extremely dry levels each night, especially in the bedroom. A modest humidifier made more difference in a week than any cough drop or lozenge had in 10 years. His aging problem turned out to be an environmental one, and it was fixable. Stories like his prove just how often the belief itself creates the barrier. Once someone sees mucus as more than an inevitable byproduct of age, they start noticing actual patterns. Is it worse in winter? Is it heavier at night or after certain foods? Does it worsen after taking particular medications? Observing those details starts to reveal the real drivers. For viewers, a helpful step right now is to note, do your own symptoms show up daily, seasonally, or after meals? That simple awareness makes the solutions ahead easier to apply. Why does the just age idea remain so ingrained? One reason is the slow pace of change. Mucus seems harmless at first, maybe a little throat clearing in the morning. Over the years, it becomes an established routine. Carrying tissues everywhere, clearing your throat before speaking, typing it up to bad air, rather than health. These changes creep in quietly until the condition feels automatic. Because mucus builds gradually, It doesn't feel like a sudden warning that would push someone to investigate. Instead, it blends into the background of normal life and, without education, gets written off as permanent. There's also hesitation to bring it up. Mucus simply isn't a subject many want to discuss. Seniors may downplay it in appointments to avoid embarrassment or avoid mentioning it to friends to keep the focus off their health. But silence allows the idea of inevitability to persist unchecked. Many quietly tolerate discomfort, assuming everyone else is doing the same. What updated data makes clear, though, is that intervention helps most cases. That means bringing it up isn't pointless. It's often the very thing that unlocks relief. Another concern is that not all mucus is minor. While dry winter air or spicy late-night meals explain many cases, long-term daily mucus can sometimes connect to more serious conditions like chronic lung disease, heart failure, or untreated reflux. Ignoring excess mucus under the belief that it's just aging risks allowing the body's warning signs to go unheard. Even when the cause is relatively simple, relief from daily irritation can still add up to better communication, improved sleep, and a lighter start to the day. This is why change begins with mindset. Once older adults question whether mucus is truly unavoidable, they open the door to options. Relief may come from adjusting environmental triggers, increasing fluid intake, or reviewing medications with a doctor. The first real shift is understanding that improvement is possible. From there, even small adjustments break through the sense of helplessness that keeps symptoms locked in place. It's worth being realistic. Yes, aging does bring physical changes. Sinus tissues dry more quickly. The tiny cilia in nasal passages move more slowly, and reflexes that once cleared mucus efficiently aren't as sharp. Those shifts set the stage for more congestion. But research makes clear that these changes do not eliminate the possibility of comfort. The gap between producing a manageable amount of mucus and struggling each morning with heavy phlegm usually depends on modifiable factors. Believing it is just age prevents practical solutions from ever being tried. The encouraging takeaway is this: seniors are not powerless against mucus, even if they've lived with it for years. By moving beyond the blanket excuse of aging, each person can investigate their unique contributors, whether it's air quality, hydration, diet, or medication. Relief often comes from identifying those triggers and addressing them directly. Seeing mucus as destiny delays recovery, while questioning it opens the way for tangible progress. And that leads to an important question many people quietly wrestle with: why does mucus so often feel worst right after waking up? The silent drip from aging sinuses. One of the most common hidden contributors is what happens inside the sinuses as we age. Subtle changes in the nose and sinus tissues create what's often called postnasal drip, a slow, steady trickle of mucus down the back of the throat that becomes particularly noticeable after resting. As the body grows older, the lining of the nasal passages loses some of its ability to stay moist. Surfaces that once felt smooth begin to dry out, and this makes mucus thicker and harder to clear. At the same time, the tiny hair-like cilia that move debris and fluid forward begin to slow. Instead of sweeping secretions out through the nose, they let mucus linger and collect. When someone lies flat during sleep, gravity encourages that collection to flow backward, which is why the effects are often most obvious in the hours after waking. The result is a set of familiar symptoms: throat irritation, the constant urge to clear, and a dry cough that may last well past breakfast. Even if the person feels fine otherwise, these sinus changes are enough to spark a cycle of discomfort. Some only notice a mild tickle, while others deal with heavy phlegm that dominates the first part of every day. The impact isn't just physical. For many, this morning ritual feels embarrassing. One older adult described trying to greet his grandchildren over the phone each morning only to spend the first minutes coughing and apologizing. Situations like this can make people pull back from conversations or avoid early appointments. Over time, the annoyance chips away at confidence and reinforces the idea that mucus simply has to be tolerated. But this condition isn't beyond help. Simple environmental and lifestyle shifts often lighten the burden. Restoring bedroom humidity prevents the nasal lining from drying too much overnight. Many homes drop to 20% humidity in cold months, while the nose does best around 40 to 50%. A small humidifier set to that range can dramatically reduce morning congestion. Sleep position is another factor. Lying completely flat allows secretions to slide straight toward the throat, elevating the upper body by just 4 to 6 inches, whether with a wedge pillow or by raising the head of the bed frame, alters the drip path and reduces the intensity of morning symptoms. Daily rinsing also makes a difference. A gentle saline wash before bed thins secretions and clears irritants, leaving less material to accumulate overnight. This simple step, supported by clinical research, is safe, inexpensive, and often surprisingly effective. So for anyone frustrated by that silent overnight drip, here are 3 things to try tonight. Run a bedroom humidifier and aim for 40 to 50% humidity. Use a saline nasal rinse before bedtime, and raise the head of the bed by 4 to 6 inches. These low-risk steps can soften mucus, protect sinus tissues, and shift how much ends up in the throat. When people try even 1 or 2 of these approaches, the difference is often immediate. Instead of starting the day with a hoarse voice and repeated throat clearing, mornings can begin more comfortably with fewer interruptions to talking, eating, or enjoying company. Relief, even partial, proves the point that age-related sinus changes are manageable and not simply inevitable. Of course, not every case comes down to sinus tissue alone. Other factors can intensify mucus production or drying, especially those linked to common health treatments. And that raises another overlooked question. Could the very medications designed to protect health also be worsening the problem? Medication side effects you never suspected. Some of the very prescriptions that safeguard health in later life can also create unintended ripple effects on the nose, throat, and airways. Clinical reviews on geriatric rhinitis point to several common culprits: ACE inhibitors, beta blockers, alpha blockers, centrally acting antihypertensives, diuretics, and certain psychotropic drugs. These are widely prescribed because they protect against heart issues, blood pressure spikes, fluid retention, or mood disorders. But alongside their benefits, they are known to trigger symptoms like nasal dryness, cough, or congestion-like irritation. For someone already experiencing slower sinus clearance with age, these effects can intensify mucus problems more than expected. Diuretic medications illustrate this clearly. By working to release excess fluid from the body, they protect the heart and reduce swelling. Yet this constant fluid loss, even at a low level, gradually dries out tissues of the mouth and nasal passages. In compensation, the body often produces thicker mucus that clings to the throat and makes clearing difficult. Many older adults don't connect this daily irritation to their prescribed medication, when in fact the link is well documented. Blood pressure drugs, especially ACE inhibitors, tell another part of the story. They lower blood pressure effectively, a life-saving role for many. But the catch is that one of their documented side effects is a consistent, sometimes nagging cough. For some, it feels like a need to clear the throat all day, and the sensation can persist through different seasons or dietary changes. Switching pillows or adjusting humidity doesn't resolve it because the trigger lies in how the medication interacts with the airway lining. Antidepressants and other psychotropic medications also appear on geriatric lists of drugs associated with nasal and oral dryness. Because many of these agents reduce saliva production, they change the texture of mucus. Saliva helps thin secretions and keep them from becoming sticky. So when it decreases, phlegm feels heavier and harder to swallow. Combine this with a normal age-related reduction in thirst, which already lowers water intake, and the result is often a persistent clogging sensation in the throat. The challenge is not just these individual effects, but how they compound when multiple prescriptions are taken together. A diuretic's dryness paired with an antidepressant saliva reduction creates an environment where mucus becomes thick, sticky, and unrelenting. Seniors may try all the classic lifestyle remedies: extra water, cutting back on dairy, using humidifiers, yet still notice morning congestion or all-day throat clearing. When everything else has been ruled out, side effects in the medication list may be the missing piece. It's important to be clear, these medications are essential. No one should ever stop or reduce a prescription without medical guidance. Hypertension drugs, diuretics, and antidepressants manage risks to the heart, brain, and overall well-being. The real solution is not to abandon them, but to recognize that if day-to-day comfort is suffering, medication side effects should be part of the conversation. Important, never stop or change a prescription on your own. Instead, bring symptoms to your prescriber and ask whether an alternative or dosing change might help. A good example is seen in routine practice. Clinicians often swap one blood pressure drug for another to reduce nasal dryness or cough. It's a common, simple adjustment when medically appropriate. In many cases, patients notice improvement within weeks. That change can mean the difference between living with a constant cough and starting the morning able to speak or sing without interruption. When raising the topic with a doctor, the key is detail. Mention when mucus feels worst, whether it's in the mornings after certain doses or during cold weather. Note any patterns of dry mouth, including nighttime dryness or trouble swallowing food. And always share a complete list of prescriptions. Geriatric reviews emphasize that medication review is a central tool for evaluating chronic rhinitis or cough in older adults. Without those specifics from the patient, patterns often remain invisible. The relief possible through careful medication adjustment is often overlooked. For many, realizing symptoms don't have to be permanently endured changes their outlook. What was thought to be aging or unsolvable congestion may actually be the body responding to an avoidable irritation. In this way, side effects offer not just frustration, but also an opportunity, a reminder to reevaluate, to ask questions, and to bring lived experience to the healthcare visit. This also raises a broader point about comfort. Seniors shouldn't have to choose between medical safety and daily quality of life. There is almost always room to balance both. When open communication with healthcare providers becomes the norm, mucus symptoms stop being written off as trivial and start being treated as real issues that impact sleep, speech, and confidence. For families and caregivers, this conversation matters too. Observing when a loved one clears their throat most often or avoids talking because of cough provides useful context to a doctor. Sometimes what patients describe as just an annoyance is seen more clearly by the people around them. Sharing those observations may help reveal medication as part of the cause. The guiding lesson here is that daily congestion doesn't always signal illness or lifestyle failure. Sometimes it's hidden in the pharmacy bag itself. And by reframing mucus as something that deserves medical attention, not just an inevitable nuisance, new pathways toward relief become possible. Even with the role of medications better understood, they're not the only factor making life with mucus more difficult. Another influence quietly shapes how airways feel, and it often explains why symptoms spike during certain seasons or in particular rooms of the home. When the air in your home becomes the enemy, cold weather months are often when mucus feels most relentless, but the reason isn't always infection or allergies. Much of the problem comes from the air seniors breathe inside their own homes. Heating systems, while essential for comfort, sharply reduce indoor humidity. Cold outdoor air already contains little moisture, and once it's warmed by furnaces or forced air systems, that dryness intensifies. The air becomes scratchy and irritating, and each breath pulls it deep into the nose and throat. The body reacts in the only way it knows how, by generating thicker secretions as protection. This same effect plays out in summer through air conditioning units. AC cools warm air, but also removes water from it. Seniors may find themselves congested in January and again in July, even when they feel healthy otherwise. It's not a coincidence. The pattern follows how artificial indoor climates strip the air of its natural balance. Older airways, already more sensitive because of thinning tissues and slower cilia, respond quickly to that lack of moisture. Instead of seeing this as just seasonal colds, it helps to consider the physiology in simple terms. Dry indoor air causes the lining of the nose and throat to become irritated. Irritation triggers more mucus production, which thickens without enough moisture to stay thin. That's why mornings feel clogged and tissues fill so fast. The cycle repeats nightly and doesn't improve until the environment changes. One retired teacher learned this firsthand. After nearly a decade of unexplained cough and heavy mornings, she tried different treatments without success. On a suggestion, she placed a small humidifier in her bedroom. Within days, her cough eased dramatically. It wasn't complex prescriptions or restrictive diets that made the difference. It was restoring moisture to the air she breathed all night. Practical steps can bring the same relief to many households, starting with humidifiers. Research supports keeping indoor air at 40 to 50% relative humidity for comfortable breathing and healthy nasal passages. By maintaining this level, mucus stays thinner, less sticky, and easier to clear. The machines come in all sizes, from small tabletop models to whole home systems. But one important precaution must be remembered. Humidifiers need regular cleaning. Without weekly maintenance, water tanks can harbor bacteria or mold, worsening symptoms instead of relieving them. Ventilation is another straightforward fix. Stale, recycled air full of irritants only compounds dryness. Opening a window for 10 minutes adds a dose of fresh air and restores balance indoors. Even cold air helps when exchanged briefly, especially during long stretches when homes are sealed tightly shut. Quick ventilation sessions refresh airflow, dilute dry air, and reduce the feeling of never escaping congestion. Hydration inside the body is as important as humidity outside it. Many older adults drink less water than they should, partly due to reduced thirst signals. But dehydration thickens mucus and makes it harder to clear. Sipping water regularly through the day, and especially in the evening, keeps airway linings moist so the body doesn't need to overproduce secretions. Combined with balanced humidity levels in the bedroom, this step can transform both the quality of sleep and the way the morning begins. These simple measures don't require much money or equipment. A basic humidifier costs less than many routine copays, and plants that add small amounts of moisture to the air are available at most stores. Ventilation costs nothing. What keeps people from trying these fixes is rarely expense. It's a lack of awareness that air can be the hidden factor driving their mucus complaints. The benefits extend beyond mornings. Those who once avoided phone calls or social time because of disruptive coughing often feel more confident again. Nights improve when deep, uninterrupted sleep replaces repeated awakenings for water or coughing fits. Even small gains accumulate, shifting mucus from an unsolvable problem to a manageable one. Still, it's important to keep expectations realistic. Dry indoor air is a major driver of senior congestion, but it's not the only one. Some mucus problems persist because of reflux, medication side effects, or allergies. But tackling the indoor climate is a powerful first step because nearly every home with heating or cooling systems experiences some level of imbalance. By correcting the environment first, seniors set a foundation for other relief strategies to work more effectively. Another common oversight is assuming dryness only matters when it's obvious, like chapped lips or itchy skin. In reality, the nasal tissues can be struggling long before those outer signals appear. Inside, the airway lining cracks, dries, and triggers persistent mucus as its quiet alarm. Recognizing these hidden signs helps prevent months or years of unnecessary discomfort. So when mucus seems to peak every winter, or even through sweltering summer days with constant air conditioning, it may not be illness or unlucky aging at all. It may simply be the invisible dryness inside the home environment. Humidifiers set to 40 to 50% relative humidity, fresh ventilation, steady hydration, and proper device maintenance are low-cost, realistic supports that often make a measurable difference. Once seniors see how quickly indoor air compounds the problem, it becomes easier to see congestion not as a permanent